सुन रहे हैं आप 104.9 FM फन एशिया रेडियो ब्रिंगिंग द कम्युनिटी टुगेदर. दिस इज मधुलिका. लेकर आती हूँ जस्ट चिल, जहाँ करते हैं हम as the name suggests, just chill. Well, today we are delighted to welcome Dr. Thakkar to our show. He's here to share his valuable insights and knowledge on oral health care. You know, today's topic is the mouth-body connection. Why oral health is overall health. Many people think of dental care as separate from the rest of the body, but research continues to show that what happens in the mouth can influence overall health. To help us understand this connection, we are joined by Dr. Abhi Thakkar, a dental public health leader and dental clinical director at Camarana Health in California. Dr. Thakkar works at the intersection of dentistry and overall health, helping families understand that oral health plays an important role in overall health. From children to grandparents, his work focuses on prevention, education, and making oral health a natural part of everyday wellness. Well, today, he'll help us explore why taking care of our mouth is truly an important step towards taking care of our whole body. Welcome, Dr. Abhi Thakkar. How are you?
I'm doing great. Thank you so much for having me, and thank you so much for the warm introduction. And I really appreciate the opportunity to talk with you and your listeners about the connection between oral health and overall health. It's really meaningful to help raise awareness about how taking care of your mouth can play such an important role in your overall well-being.
Well, we love it too because, you know, you simplify these complicated terms and you explain to us how simply, you know, doing simple things, we can really take care of our oral health. So thank you so much for joining us.
Thank you.
All right, Dr. Thakkar. So I do have a couple of questions to ask you on behalf of our listeners.
Yes.
Okay, so we've always thought of teeth as separate from the rest of the body. Are they really connected to our overall health?
They're absolutely connected. The mouth isn't the mouth isn't outside the body. It's a part of it, right? So our gums are full of tiny blood vessels. Our immune system is active there every day. So when gums are healthy, they form a tight seal around the teeth, almost like a weather stripping around a door. So I would say when plaque, soft deposit builds up and gums get inflamed, that seal kind of weakens, and this becomes easier for bacteria to now enter the bloodstream. Think of it like a doorway. When the doorway is secure and intact, things stay where they belong. But if the doorway becomes damaged, things can move in and out more easily. That's why I would call the mouth a gateway. It's not just about cavities, it's about inflammation. So the mouth is not just connected, it's often an early indicator if something's happening inside the mouth, then there's a possibility it's also happening inside the body. The biggest takeaway here is taking care of your mouth is not just cosmetic, it's not just about preventing cavities, it's actually also about protecting a part of the body that is closely connected to circulation, immunity, and overall.
Well, that's so interesting a perspective to, you know, look at it. So, you know, कई बार हमने सुना है that gum disease can actually affect the heart. How does something in our mouth impact heart disease or a stroke?
Okay, think of gum disease as a chronic infection sitting right next to your bloodstream. When gums bleed, bacteria can travel through the circulation. Heart disease and stroke are also linked to the inflammation in these blood vessels. Now, it's not as simple as saying that gum disease causes heart attacks. That would be really oversimplifying it. But what we do know is that chronic inflammation anywhere in the body is not good. And the mouth is one place where chronic inflammation is very common. So gum health becomes one more controllable factor. We already know things like not smoking, eating well, exercising, managing blood pressure can reduce your heart risk. But taking care of your gums also fits into the same prevention picture. And I would say the encouraging message for families listening today is that you cannot control every risk factor for heart disease, right? So, but you can control daily habits like brushing gently, cleaning between your teeth, and not ignoring your bleeding gums. So I would say, really, when we reduce inflammation inside the mouth, we reduce one potential source of threat.
Interesting. Are there certain nutrients or foods that we should focus on to keep our teeth, gums, and bones strong?
I love that question, and that's a really important question because teeth and gums need building materials and repair tools, just like the rest of our body. So I would say some nutrients or foods I would mention here is calcium and phosphorus, right? These are main building blocks of the teeth and bones. They keep enamel or outermost protective layer and bone strong. And I would say some sources are like dairy, leafy greens, beans, and nuts. Now, second is I would say vitamin D. This is called as helper. Now, it allows the body to actually use calcium properly. So without vitamin D, calcium cannot do its job well. And some sources I would say it could be like sunlight, some foods like milk, yogurt, breakfast cereals, or oranges. And third would be vitamin C. This protects the gum. It helps keep gum tissue strong and healthy because low vitamin C can actually also lead to bleeding gums. And some kind of foods that I would recommend will be citrus fruits, berries, peppers, and vegetables. And fourth would be protein. Protein helps the body repair tissue and fight infection. So the mouth deals with bacteria daily and it needs protein to heal. And some kind of foods that I would recommend would be something like eggs, fish, beans, dairy, and nuts. So I would say these are some kind of nutrition foods that will really help keep our teeth, gums, and bones strong. But the most overlooked part over here is frequency. It's not just about what we eat, it's about how often we eat. And frequent sipping on sugary drinks or constant snacking keeps the mouth in acidic mode, and that repeated acidic exposure increases the cavity risk. So again, simple takeaway would be focus on balanced meals, limit sugary drinks, drink water between meals, and avoid constant snacking. So, and again, oral health does not really start in the dental chair, it starts in the kitchen. So, nutrients we give our families every day are the building blocks for stronger teeth and healthy gums and long-term overall health. And again, I'm grateful that through my collaboration with Dairy Council of California, we're translating evidence-based nutrition education into everyday habits, highlighting how calcium, vitamin D, and balanced dietary patterns are actually linked to improving oral health and broader systemic outcomes.
Is it true that people with diabetes seems to have more gum problems than other people? Like, what's the connection there?
Yes, you are right. And that's a great question because diabetes and gum disease affect each other. It goes both ways. When blood sugar is high, the body does not fight infection as well, and healing slows down. Now, this makes the gums more likely to become inflamed and infected. High sugar levels also creates an environment where bacteria grows more easily. Now, at the same time, untreated gum problems and gum disease increases the inflammation in the body. Now, that can make the blood sugar harder to control. So think of it like this. If the body's defense team is tired and slow, even a small problem can grow into a bigger one. So it becomes a cycle. And high blood sugar worsens the gum disease, and gum disease makes blood sugar harder to manage. So that's why taking care of your gums isn't just about teeth, it's really about also a part of managing diabetes. And that's why regular dental checkups and not ignoring bleeding gums are especially important.
Interesting. And then when it comes to oral cancer, what warning signs should we not ignore?
I'll keep it simple. This is a very simple rule to follow. If something inside your mouth does not heal within 2 weeks, get it checked. Watch for a sore that won't go away, a red or white patch, a lump, ongoing hoarseness, difficulty swallowing, numbness in the lips, tongue, or mouth, and any unexplained bleeding, or it could be any type of pain that does not go away. So one important thing to understand is that early oral cancer is often painless.
Right.
That's why people sometimes delay getting checked. They think if it doesn't hurt, it's probably nothing. But pain is usually a later sign, and that's why. So listeners, please do not ignore changes. Don't wait for pain. And if something has not healed in 2 weeks, we should at least get it looked at.
So 2 weeks window is very important, that keep a close check, and if in 2 weeks it's not changing or working, then definitely see a doctor.
Absolutely.
Okay, then कई बार होता है जब हम deep cleaning के लिए जाते हैं, right? So our teeth suddenly start to feel loose. Is this normal?
That's a great question because I do get this kind of a question a lot.
Yeah, मतलब I remember my दादी, when she used to get her teeth deep cleaned, तो वो बोलती थी अरे डॉक्टर साहब ने पूरे दांत हिला दिए, हमारे तो दांत ही हिलने लगे. So is it true that deep cleaning के बाद some teeth feel loose?
I would say that's not the case at all. We shouldn't. So I would keep it simple for our listeners again. We should not panic, but we also should not ignore it, right? Because healthy gums usually don't bleed with gentle brushing. Bleeding is often a sign of inflammation. It's like a smoke alarm that something is irritated, something's off, something's going wrong. And that irritation usually starts when plaque builds up, that is a soft deposit, or along the gum line. And if this is caught early, it's actually reversible. But if ignored, it can move deeper and affect the bone that holds the teeth in place. So again, a loose feeling can happen for several reasons, right? It could be gum inflammation, bone loss, and I know again I'm trying to say few more things apart from the question that you are asking, but I just want to make sure that our listeners understand because you might see even bleeding when brushing, or the tooth feels a little loose, so if they should be worried about it. But again, the key message is simple: bleeding and loose teeth are not normal agents; they're warning signs, and early action can prevent bigger problems later. Now, coming back to your question, after deep cleaning, why do teeth sometimes feel looser? This actually surprises people, but the cleaning does not really loosen the tooth. Before treatment, there may be hard buildup, plaque, swollen gums, filling space around the tooth. And when that buildup is removed and swelling goes down, that area can feel more open and gums can now breathe. The tooth may feel slightly different, but not because it was loosened by cleaning, but because the unhealthy tissue that were masking the true condition are no longer there. I'm gonna, try to give a simple thing for our listeners to understand. Think about when your finger has been swollen and you are wearing a tight ring. The swelling makes everything feel snug. The ring feels secure. Now imagine the swelling goes down and you take the ring off. Suddenly your finger feels different, maybe slimmer, maybe lighter. It might even feel like there's more space than before. But nothing really damaged your finger. Nothing made it smaller. It's just that the swelling simply reduced. And that's why, again, so the key message here is that if a tooth feels a little different after deep cleaning, that can be a part of the healing process. But stay consistent with your home care and follow up with your dental professional.
Okay.
Stability really improves when the inflammation is controlled.
How often should we be replacing our toothbrushes? कई बार होता है कि जब बिल्कुल ही वो बेशक्ल हो जाए तब हमें फेंकना चाहिए, या what is the right time? And are most of us really brushing the right way?
I would say a good rule of thumb is your toothbrush about every 3 months. But honestly, the calendar is not the only guide. Your bristles of the toothbrush will tell you the truth. So if the bristles look frayed, bent outward, flattened, or even, it's uneven, I would say it's time for a new toothbrush that time. But you should also replace your toothbrush after being sick, even if it falls on the floor. So the simple take-home message here is that replace your toothbrush every 3 months, but you can replace it sooner if it looks worn or any other problems that I mentioned earlier.
I see.
Coming to the second part of your question, you say, I think, does brushing...
how would you know what is the right way of brushing? Are we brushing our teeth correct way?
Yes. So I would say that better approach is, we are using soft bristle toothbrush. We're holding it at a slight angle towards the gums. Small, gentle circular motion. Spend about 2 minutes brushing. And then flossing, right? And clean along the gum line carefully. That's the most important part. A lot of people don't do that, so that's why I always make sure I tell all my patients clean along the gum line really carefully, because that's the area where bacteria really sits a lot. And again, the second mention, don't forget between the teeth, because brushing alone misses those spaces. So flossing is also very, very...
So if you could, if one could start just one simple habit today to protect both our mouth and our overall health, what would that one recommendation be from you?
If there's one habit that I would recommend, it's this. Pay attention to your gums. Please don't ignore bleeding. Don't ignore changes. Don't wait for pain. Most people brush their teeth because they don't want cavities, but your gums are just as important, maybe even more important, because they are the foundation that holds everything in place, and they're closely connected to the rest of your body. So here's what that habit looks like in real life. If you see bleeding when you brush, don't say it's normal. If your gums feel swollen, tender, or you notice bad breath that doesn't go away, don't ignore it. If something inside your mouth does not heal within 2 weeks, get it checked. Because healthy gums generally don't bleed with normal brushing. Bleeding is usually a sign of inflammation, and inflammation inside the mouth doesn't just stay inside the mouth. The gums are full of tiny blood vessels, right? So when they're inflamed, it's easier for bacteria to enter the bloodstream. But again, the good news, gum disease is largely preventable and manageable. So one simple habit is this: pay attention to early warning signs and act early. If we remember that the mouth is part of the body, not separate from it, we start making better choices for both.
Well, Dr. Thakkar, thank you once again for joining us and sharing your knowledge on oral health care. We truly appreciate you taking the time out to be with us today and making things so simple, making us understand these things in such a simple manner. Thank you so much once again.